Good morning and welcome to Y.Y.C.I International Academy Masterclass for mindset for transforming relationship, marriage, and family. And this morning we have various professors coming all over the world to come and share their wisdom and knowledge and experience on this particular theme of the master class. And this morning, the very first professor that will be sharing with us on professional counseling is Professor Dr. Pratik Mungekar. Professor Dr. Pratik Rejan Mungekar is a globally recognized scientific professor, counselor, and international speaker. He has made groundbreaking contributions to sustainable development and is widely regarded as one of the world leading experts in this field. Professor Dr. Mungekar is a trailblazer in his field and has achieved several notable feats. He was the first youngest Indian whose book Introduction to Sustainable Development Goals, non-academic, became part of Atlanta education program. Dr. Mungekar has received an impressive 300 plus honorable doctorate from all over the world, making him one of the most recognized experts in his field. He has also taught over 18,000 plus students and career guided 49,000 plus students. And he continues to inspire and educate future leaders. He has appointed 70 plus organizations at various high positions at the same time, and also appointed ambassador by 65 bodies almost in all disciplines. In recognition of his contribution to teaching and research, Professor Dr. Mungekar has received 950 international, national, and state awards, 9 national scientific patents, and 18 world records, making him one of the most decorated academics in the world. Professor Dr. Mungekar is a visiting faculty member at 63 plus many national and foreign universities, and he served as Director of Research Innovation at Oxford University, Lighthouse Leadership University, Dominion of Impact International Bible University, and the Global Ministry Disciple Institute, and the Dean of International Development at Theophany University. Professor Dr. Mungekar is also a successful author of 7 books, including Introduction to Sustainable Development Goals, Education and Internal Assets, Leadership, Superintendence, Sustainable Origin, Finding Balance, Inscribe, and Stem Cell Science, which is a bestseller. He also co-author of 50 books, represented in India in more than 400 plus international conferences as keynote speaker, published more than 45 research papers in various international journals, also working as editor for some journals. As a vice chancellor at Unified Theological Seminar USA, University of Kingdom of Atlantic in Singapore, Webster University in Zimbabwe, Wisdom University Gombe in Nigeria, Dr. Mungekar brings his experts to these prestigious institutions. Additionally, he is the first youngest Pro-Chancellor, founder of the University of Expertise, which speaks to his entrepreneurship spirit and dedication to innovation. After serving 14 months as Vice Chancellor this year, he got promoted and became the Chancellor of Wisdom University Gombe, Nigeria. He is the first Indian to be appointed as Dean in CCOL London, first India to be appointed in all academic high position at the same time. Professor Dr. Mungekar achievements have earned him several prestigious titles, including Lecturers Magnificat, HRH, Duke, Sir, and Medallion Fellowship, United Kingdom, highest academic honor. He is also the first Indian to receive the distinguished title Professor Wisdom for Instituto Cultural Colombian Casta Potato Magia Polo Colombian South Africa, South America. So allow me now welcome Professor Dr. Pratik Mungekar from India to share his wealth of knowledge and wisdom and experience. I must say, this professor travels all over the world, but we are still blessed and privileged to have him regularly to sharing his wealth of wisdom, knowledge, and experience, always on Yes You Can International Academy. You are welcome, sir. Thank you for joining us today.
Thank you. Thank you so much, Professor Dr. Elizabeth Lucas, for the kind introduction and invitation. And it has been always a pleasure to be here in our Yes You Can International Academy and this prestigious platform. Okay, so today my topic is professional counseling. So many disciplines, whether closely related to the counseling profession, for example, social work, or not, for example, finance, nutrition, and dietetics. So, all these utilize counseling to describe the nature of their work. At times, the utilization of this term can be confusing to the general public and consumers. It is guaranteed that once in your lifetime is a what you can say once in your lifetime as a professional counselor, you will be asked what is counseling. You may also be asked, is counseling the same as psychotherapy? Do you have an idea how to respond to these questions and to describe professional counseling? So there are ongoing debates about the similarities and differences between counseling and psychotherapy. I have written one book on the same topic, which I name Finding Counseling, Finding Balance, Exploring Counseling and Psychotherapy, because I believe counseling and psychotherapy, these are the two different disciplines. So you may find that many counseling scholars and counselors use both terms interchangeably. Historically, psychotherapy was differentiated as a form of helping that focused on serious problems of an intrapsychiatric nature with treatment delivered by the trained professional. Now, traditionally, professionals have differentiated between the two terms using the using some criteria. Okay, the first, length of treatment. Psychotherapy is a long-term counseling, and counseling is short-term. Okay, so this is one criteria: length of treatment. Psychotherapy is long-term, counseling is short-term. Then seriousness of presenting issues. Okay, so in psychotherapy is more it's for more serious issues, whereas counseling is for less serious issues. Okay, then the third point is physical location of treatment. Okay, psychotherapy is offered in an inpatient setting, whereas counseling is offered in an outpatient setting. Then the focus on treatment. Okay, so psychotherapy focuses on past issues, counseling focuses on present issues. Okay, then the type of presenting issues. Psychotherapy is for long-term personality disorders like mental illness. Okay, and counseling is for development issues of everyday existence. Okay, it includes mental health also. And the last criteria is outcomes. So psychotherapy offers insight, counseling facilitates action. Okay, so this is the basic difference between psychotherapy and counseling. Both are altogether different. Okay, now in practice, these historic and traditional differences have blurred and are no longer justified. As a result, counseling practitioners and consumers often use both terms interchangeably. However, as the practice of professional counseling has become an identifiable profession with educational requirements, training standards, and ethical code, and of course, codification in state legislation and regulations, professional counseling has become a well defined field with the number of licensed professionals surpassing number of practitioners of both psychology and social work. Now, the definition, what is counseling? Why do we need to know its definition? See, professional counseling has an evolving definition. Over a decade ago, the American Counseling Association, which is ACA, the primary association in the United States representing professional counselors, defined professional counseling as the application of mental health, psychological, or human development principles through cognitive, affective, behavioral, or systematic interventions, strategies that address cognitive, then affective, behavioral, or systematic interventions, what you can say, personal growth or career development, as well as pathology. So, more recently, this American Counseling Association established a task force, okay, a vision for the future of counseling to reconceptualize the definition of professional counseling. And currently, professional counselors refers to a professional relationship that empowers diverse individuals, families, and groups to accomplish mental health, wellness, education, and career goals. So the definition simplifies the nature of the counseling relationship, roles of professional counselors, and consumers of professional counseling services and practices areas of professional counselors. Now, um, see, there is one more concept we call self of the counselor. Now, the counselor is an instrument in the therapeutic process. Okay, many prominent counseling theorists emphasize the importance of self of the counselor. Now, the therapy is a deeply intimate and vulnerable experience requiring sensitivity to one's own state of being as well as that of the other. So, it is the meeting of the deepest self of the therapist with the deepest self of the patient or client, because the self of the counselor is believed to be to be a vital part of the promoting the client's optimal growth and development. So one of the counselor, Rogers, suggested that for the therapy to be effective, the counselor needs to provide three conditions of growth. Okay, unconditional positive regard, congruence, and empathy with the client. So, building on Rogers' conditions of growth, recent research studies found that in order to achieve favorable therapeutic outcome, counselors should be empathetic, warm, supportive, and hopeful when working with their clients. So, these characteristics of counselors allow clients to feel understood, accepted, empowered, and encouraged. Then, one of the ACE counselor, Glading, further recommended that counselors should possess personal qualities of maturity, empathy, and warmth in order to help clients to feel comfortable and to allow clients to share their stories about their stories without feeling judged by the counselor. However, you may have heard a story about or may have even experienced an ineffective counselor who does not seem to listen to the client and often expresses anger or frustration towards her or his client. So, this situation can emerge for various reasons, including a lack of understanding of counseling and its process, poor training or life stressors on the counselor. Those reasons, except personality, are likely to be corrected and improved via education, training, and supervision. In contrast, if the counselor expresses anger or frustration towards her client caused by personality issues, for example, tantrums or egocentricity or negative motivations like loneliness, assertion of power and control, okay, of the counselor, this issue needs to be further examined. So the personhood of counselors is one of the most essential factors for facilitating the client's growth and development. Therefore, self examination and reflection are indeed important to the development and growth of counselors. So, self examination and reflection can facilitate the counselors' understanding of their motivations, desires, and actions related to becoming professional counselors. So, to what you can say, mm, yeah. In addition to examining your thoughts and reflecting on your feelings associated with becoming a professional counselor, a reflection on the self of the counselor involves the examination of your values and beliefs. So, personal beliefs and values play a very important role in the work of professional counselors with clients. For example, you may find it difficult to work with clients who are unmotivated and less ambitious because these characteristics conflict with your personal belief system that people should be motivated, high achieving, and highly ambitious. So it is essential that you examine and confront your personal motivations, beliefs, and values in order to be an effective counselor who is able to recognize and filter your personal motivations, beliefs, and values when working with clients who are different from you. So, the next point which I'm going to emphasize is the therapeutic relationship. You by now have grasped how important it is for professional counselors to be aware of self and their motivations in entering the counseling profession, as well as their personal values and beliefs. So, this awareness is important because professional counselors use themselves as a therapeutic tool to help their clients achieve optimal growth and well being. So, as mentioned earlier, modern research studies have suggested that counselors should possess the four characteristics, okay: empathy, warmth, supportiveness, and hope. So, in order to facilitate favorable therapeutic outcomes, these four characteristics contribute to the development of a collaborative therapeutic relationships in which the client and counselor work together to facilitate changes in the client. Needless to say, such a relationship occurs when both parties, the client and counselor, are in agreement on how counseling should be. So, it is important, however, to note that counselors are responsible for initiating a warm and accepting therapeutic environment that allows the clients to be willing to confront their issues, assume responsibilities, and ultimately reach resolutions to their problems. Now, there are therapeutic factors. Okay, regardless of the theoretical approaches employed, professional counselors are required to build a collaborative therapeutic relationship with clients in order to facilitate the clients. So, self exploration and to help them achieve their optimal well being. Okay, Frank and Frank, okay, in 1991, described common factors as active ingredients or core elements that are infused in every therapeutic approach. So, one of the counselor, Lambert, identified those factors as extra therapeutic factors or therapeutic relationship factors. So, hope and expectancy and therapeutic models and techniques. Uh, uh, what you can say, extra therapeutic factors refer to the client's factors such as willingness to change. Then the therapeutic relationship factors refers to the characteristics of the counselor such as warmth, empathy, and acceptance. Then hope and expectancy refer to the client's perception that her or his presenting issues will be elevated, or that therapy will have an even better outcome. So therapeutic models and techniques refers to the theoretical approaches and strategies that counselors employ in treatment and interventions. So according to reviews of their outcome studies in counseling and psychotherapy, these two fellow, Lambert and Barley, concluded that these common factors, that is, the characteristics of the counselors, nature of the therapeutic relationship, accounted for 30% of a client's overall improvement in treatment. So, as mentioned in earlier, professional counselors and clients play an important role in the therapeutic process and outcome. So, you now understand the importance of professional counselors possessing warmth, empathy, and acceptance in order to develop a meaningful therapeutic relationship and to facilitate change in their clients. So, professional counselors need to be able to show the clients these qualities throughout the therapeutic process. Okay, now I explain therapeutic factors. Now, the therapeutic process. So now, see, counselors in training often find themselves nervous and anxious when they first see the client. Questions such as, what should I do in the counseling room? Or what do I do first? Or can I take my lecture notes with me in the room so I know what to do? Like that, some general questions generally come up during their first clinical experience. So, this need to know behavior is considered normal, as the counselor needs to understand the stages of the counseling process and how they unfold. So, because counseling is a combination of art and science, the therapeutic process cannot be prescribed as step-by-step model, as it largely depends on the theoretical approaches and work setting of the counselor. Nonetheless, there are common stages of the counseling process that provide you a framework when working with clients, regardless of your theoretical orientation or work settings. So there are 6 stages in the counseling process, include establishing the relationship, assessment, treatment planning, intervention, evaluation, and termination. So let us discuss these stages one by one. Now, the stage one is establishing the relationship. Okay. As previously mentioned, the relationship is central in the counseling process and is an essential factor that leads to successful therapeutic outcomes. So you can imagine how difficult it must be to share very personal details about or undesirable qualities of yourself to a complete stranger. See, this is very difficult. So all human beings, including your clients, want to feel respected and accepted, although one knows that her or his actions are not exactly acceptable. For example, stealing, having an affair. Okay. So, counseling is a process in which clients can discuss those thoughts and feelings with the counselor who genuinely accept them just as they are and cares about their well being. Therefore, counselors should create an inviting therapeutic environment that invites the clients to share their struggles and sufferings without feeling judged. So, to create such an environment, counselors need to demonstrate their warmth, acceptance, and empathy to their clients. So, this is first step, okay, establishing the relationship. Now, the second stage is assessment. The purpose of the assessment, sometimes called the initial interview or intake assessment, is to evaluate the relevant factors that contribute to the client's presenting issues. So, such as interpersonal relationships, or financial situations, medical conditions, and family history. So, the counselors may conduct an initial assessment based on their theoretical orientation or work protocols. For example, asking the client's history of substance use in an addictions counseling facility, Okay, we generally inform the focus of the assessment. Okay, past versus present conditions, like that. So professional counselors utilize many forms of assessment, including having an informal conversations with the client, using a set of structured questions, conducting behavioral observation to determine the client's behavioral and emotional state, and using empirically validated assessments or instruments to assess behavioral and emotional issues of the client. Often in clinical mental health setting, for example, hospitals, behavioral health clinic, professional counselors are required to diagnose the client with a form of mental disorder by using standardized diagnostic criteria. For example, Diagnostic and Statistical Manual of Mental Disorders, or DSM, etc. So the diagnosis then serves as a starting point of the treatment, as it informs the counselor about the nature of the disorder and its symptoms, for example, development or progression, and treatment planning, like intervention, strategies, or amount of time and resources involved. So this is about stage 2 assessment. Now the stage 3 is treatment planning. Okay, the treatment planning stage is a collaborative effort between the client and the counselor to generate therapeutic goals and ways to achieve them. So it is important that clients be actively involved in treatment planning, because they are the one who will carry out the treatment plan. So when planning the treatment with a client, professional counselors should consider the following factors. The first, treatment plan should be tailored to the client's unique needs and presenting issues. For example, not every client who presents with depressive symptoms will have the same goals, interventions, and the amount of time spent in counseling. Then the second, the treatment plan should reflect optimistic, realistic, and attainable goals that the client is able to achieve. The third, the plan should be concrete and measurable. For example, behaviorally specific actions in order to determine whether treatment goals have been accomplished at the end of the counseling. And the last one, the plan should be flexible. These are the four factors. The plan should be flexible so that the counselor and client can adjust or modify it as needed. Then the next stage 4 is about intervention. Professional counselors often use therapeutic interventions, often called techniques, so that derive from their theoretical orientation or model in counseling. So therapeutic interventions align not only with counselors' theoretical approach, but also with the treatment goals. That is, professional counselors use interventions to help clients accomplish set goals like increase self-esteem, decrease depressed mood, and that promote their mental health and well-being. So interventions are used to help clients gain insight or take action. While insight presents some values, actions are what you can say are very important to clients, as actions facilitates changes within and outside of the therapeutic context. So considering the use of therapeutic interventions, it is important that professional counselors utilize interventions that are known or suggested based on research and or literature to be effective with the clients presenting issues to ensure ethical practice. Then the stage number 5 is evaluation. So once they have implemented therapeutic interventions, professional counselors are responsible for evaluating the therapeutic process and outcomes to determine whether those interventions served the treatment goals. There are methods of evaluation include formative and summative evaluation. So formative evaluation refers to an evaluative method that occurs throughout counseling in order to periodically assess the client's progress towards therapeutic goals. Then summative evaluation, on the other hand, refers to an evaluative method that occurs towards the end of the counseling process to determine whether the therapeutic goals have been accomplished. Formative evaluation has its focus on the counseling process, whereas summative evaluation has its focus on the counseling outcome. Regardless of the method of evaluation, there are many strategies that professional counselors can utilize to evaluate the therapeutic processes and outcome, including having informal conversations with clients to assess their perceptions of change, observing behavioral and emotional changes in clients, and using empirically validated assessments or instruments to quantify changes that occurs while clients were in counseling. So it is important for you to understand that professional counselors can utilize more than one evaluation method as appropriate in order to have a better picture and more well-rounded perspective on the therapeutic process and outcomes, which ultimately inform adjustment or improvement in the counseling process and often the counselor themselves. Then, stage number 6 is termination. So, once the client achieves a satisfactory therapeutic outcome, it is time for termination, where the client can generalize what she or he learned in counseling to other life contexts such as family, community, or work. Ideally, termination happens when the counselor and the client mutually agree that the client has achieved the treatment goals, and it provides a sense of closure for both parties. So professional counselors need to prepare clients for termination by supporting their independence, encouraging them to take charge of their own lives, helping them identify problems they have overcome throughout the counseling process, helping them plan for future situations and actions, and helping them setting up long-term goals to help you better understand the counseling process. Throughout the therapeutic process, these professional counselors work collaboratively with clients to achieve therapeutic goals. As you can imagine, achieving therapeutic goals is not an easy process for either the client or the counselor. Many believe that goal achievement is possible when uh, when the client and counselor are able to work collaboratively with each other to achieve the same goals and have a strong therapeutic alliance, which will be very important to achieve that relationship or to achieve what you can say the termination process. So, as I mentioned, there are 6 stages of the counseling process: establishing the relationship, assessment, treatment planning, intervention, evaluation, and the last one is termination. Then, the next point, which is also very important, is about uh, therapeutic alliance. Therapeutic alliance, often called working alliance, is defined as a collaborative process whereby both client and therapist agree on shared therapeutic goals. Okay, collaborate on tasks designed to bring about successful outcomes and establish a relationship based on trust, acceptance, and competence. So, therapeutic alliance comprises 3 important components of the relationship: counseling, relationship, and collaborative goals, and trust, which can bring about changes and help clients to achieve their goals. So, needless to say, therapeutic alliance is critical to the treatment outcome. So, when the client and counselor have a bond shared agenda and goal, the client is likely to reach her or his goal. So this collaborative relationship not only facilitate change during the counseling session and by the end of the treatment, also helps clients feel empowered with a sense of confidence in their ability to cope up with their future issues. So you may wonder how you, as a professional counselor, can create a warm, accepting, and supportive therapeutic environment and relationship, as well as build a strong therapeutic alliance with your clients throughout the counseling process. So as you move further through your what you can say gradually when you train, okay, in counseling, you will learn you will come to know the necessary skills that professional counselors by experiences, okay, use to build a therapeutic relationship with clients. Then there are some micro skills also. Micro skills. What do you mean by micro skills? Micro skills are the foundational skills of effective helping relationships. Okay, so professional counselors employ these skills to create a necessary conditions from which positive changes can occur. So through empathetic understanding in a non-judgmental, accepting and safe environment, individuals can grow and change in a positive direction. So to create such a therapeutic environment, professional counselors are trained to appropriately use their micro skills when working with clients. So there are many micro skills. For example, attending. The first micro skill is attending. Okay, communicate to the client that you are attending her story or his story through non-verbal. For example, head nodding, yes, or eye to eye contact, or verbal like yes, oh, okay, yeah, like that word acknowledgement. Then the second micro skill is listening. Pay attention to the client's story to accurately capture his or her thoughts and emotion. Then the second, the third micro skill is silence. Pause after the client's statement to help her elaborate more on the story and or to provide a brief moment for the client to reflect on her or his story. Then restatement. This is the fourth micro skill. Restatement. So rephrase the client's primary statement or response to let him know that you are listening and paying attention. That is restatement. Then reflection of feelings. Reflect the expression, emotions, and or feelings associated with a particular event or story that the client tells you. Then the next skill is summarizing. Capture the content, both thoughts and emotions, or identify themes or patterns associated with the client's story in order to keep the therapeutic conversation focused and to promote clarification. And the last one is probing. Probing means ask open-ended questions to facilitate the client's understanding and exploration of her or his story. So to help you better grasp, professional counselors, utilize all these micro skills in the counseling session. So the when they use these micro skills, the results are way better. So it is important to understand that micro skills do not pertain to a specific counseling theoretical approach. Okay, rather micro skills are meant for counselors, regardless of their theoretical orientation, to use foundational skills to facilitate the counseling process and to support the therapeutic relationship with the client. Although counseling researchers have suggested that there are common factors such as empathy and therapeutic relationship are very important, but in reality, professional counselors implement theoretical, what you can say, theoretical frameworks as their approaches to treatment and interventions different as per the client. So, as a part of counseling training, you have to understand the theoretical framework also, philosophies also, and accordingly you have to guide and work uh, towards the betterment of your client in professional counseling. So yeah, I think I have covered all the basic aspects of professional counseling. So
Thank you
yeah,
so
basically
much.
it's a very huge topic. Okay, but yeah, I have covered, and the floor is open now for
Questions.
questions.
Thank you so much, Professor Dr. Patrick Mungekar. I like the way you started it by sharing with us that because I never knew. Um, and I was also curiosity want to know about it, the differences between a counseling and also
Psychotherapy.
psychology. Yes. So you've really started very well by introducing and telling us more about that. I also like the fact that you really emphasize on it. But my question is quickly before you go is, this is a random question. I noticed that, I don't know if another part of the country, but here in UK, it's same thing. Likewise, I'm sure the same thing will happens to the doctors, the nurses, and also the police. But my concern is, why is it necessary that we spend more time on paperwork than the actual counseling?
What's your question? Why is
Why
necessary?
is it that, why is it necessary that we spend more time on paperwork, all these forms and other things, more than the actual counseling or psychology?
Do you mean in the professional counseling
Yes, in the
clinic?
professional counseling, yes.
Spending time on paperwork in counseling may seem like a bureaucratic what you can say chaos, but it serves several crucial purposes that are integral to the effectiveness and ethical practice of counseling. So, for example, documentation and legal compliance. So paperwork in counseling involves documenting client information, the session notes, treatment plans, and progress reports. So these records are not only essential for maintaining accurate and comprehensive client history, but also for legal and ethical compliance. So they serve as a safeguard in case of disputes, complaints, or legal proceedings, ensuring that counselors uphold professional standards and adhere to regulatory requirements. Then again, the second factor is very important here: continuity of care. Detailed documentation facilitates continuity of care by providing a roadmap for ongoing treatment. So when counselors leave or transition, comprehensive records enable their successors to seamlessly pick up where they left off, ensuring that clients receive consistent and uninterpreted support. So this continuity is especially vital for clients with complex needs or long-term therapeutic goals. Then these documentation are very important for treatment planning and evaluation. So paperwork such as treatment plans and progress notes helps counselors develop tailored interventions and evaluate their effectiveness over time. So by systematically tracking clients' progress, these counselors can identify different patterns, assess the impact of intervention, and make informed adjustment to treatment strategies as needed. So this process promotes accountability and ensures that counseling remains client centered and goal oriented. Then of course, for collaboration and communication, documentation serves as a means of communication and collaboration among multidisciplinary teams such as healthcare providers, social workers, and educators. So shared records facilitate coordinated care, enabling professionals to exchange relevant information, coordinate interventions, and advocate for the client's holistic well-being. So effective communication supports a collaborative approach that maximizes the client's support network and enhances outcomes. Then, of course, ethical consideration and risk management. This is important. Maintaining accurate and confidential records is essentially for upholding ethical principles such as confidentiality, informed consent, and professional boundaries. So, paperwork helps counselors navigate ethical dilemmas such as situations involving duty to warn or mandatory reporting by documenting their decision making process and rationale. Furthermore, through documentation, minimizes the risk of errors and misunderstanding of breaches of confidentiality, thereby safeguarding the trust, very important, and well-being of clients. And of course, quality assurance and professional development. So paperwork contributes to the quality assurance and professional development by facilitating self-reflection, supervision, and ongoing learning. So reviewing all the session notes, case histories, and treatment plans allows counselors or rather professional counselors to identify areas of strength, areas of improvement, and opportunities for professional growth. So additionally, supervision and peer review processes provide valuable feedback and support counselors in refining their clinical skills and enhancing the quality of their practice. So yes, paperwork may seem time consuming, but its role in counseling is indispensable for maintaining ethical standards, ensuring continuity of care, promoting collaboration, and enhancing the quality and effectiveness of counseling services. So, by investing time and attention in documentation, these counselors uphold professional integrity, support client well being, and contribute to the advancement of the counseling profession as a whole.
Wow. Thank you so much. Thank you so much for giving us that in depth, the information, and also explaining it all to us. Before you go quickly, only one question more from me. I don't know if Reverend Professor, do you have any questions, sir? For I know you joined late, but I don't know if you have any question. And Ambassador Dr. Stephen Temitope Davidson, do you have any question? So I'm going to ask my own last question. And if you have any question, please let's ask before we release Professor Patrick. Now, the last question I will ask from our own end is, what's the difference between mentor and counselor?
Hello, can you hear me?
Yes, we can hear you. What is the difference between mentor and counselor?
Oh, okay. Actually, it depends on perspective. Okay, I believe. Because mentor and counselor play distinct yet complementary roles in supporting individuals' personal and professional development. Okay, while there may be overlap, what you can say, in some aspects of their functions, but there are also key differences in the approaches, goals, and relationships with those they support. So there are some differences between mentors and counselors. For example, the first difference is purpose and focus. Okay, now see, mentors. Mentoring relationships typically focus on providing guidance, advice, and support related to career advancement, skill development, and goal achievement. So, mentor draw from their own experiences and expertise to offer practical insights, encouragement, and networking opportunities to help mentees uh, drive their career paths and overcome challenges. Now, counseling relationships are centered on addressing psychological, emotional, and behavioral concerns such as stress, anxiety, depression, relationship issues, and personal growth. So, counselors employ therapeutic techniques and interventions, as we discussed earlier, to help clients explore their thoughts, feelings, and behaviors, gain self awareness, develop coping strategies, and work towards positive change and well-being. So this is purpose and focus of mentors and counselors. Now the second is nature of relationship. Okay, mentors. Mentorship often involves a voluntary, informal relationship between more experienced individual like the mentor and a less experienced individual, the mentee. So mentors typically serves as the role model and advisors, offering guidance and support based on their own experiences and expertise. So the mentor-mentee relationship may evolve over time and can be characterized by mutual respect, trust, and support. Where counseling involves a formal professional relationship between trained counselor and a client seeking support for specific issues or challenges. So the counseling relationship is governed by ethical guidelines and boundaries, which we discussed earlier, to ensure confidentiality, trust, and respect for the client's autonomy. So counselors provide a safe and supportive space for clients to expose their concern, gain insights, and work towards personal growth and healing. Then, of course, training and qualification. Mentors may come from diverse background and professions, and they typically often guidance based on their own experiences, expertise, and insights. While formal training in mentoring may enhance their effectiveness, mentorship is often, informally acquired through professional networks, relationship, or shared experiences. Where counselors undergo specialized education, training, and licensure to practice in the field of mental health or counseling. So they acquire knowledge and skills in counseling theories, therapeutic techniques, assessment, diagnosis, all those stages, and ethical practices through graduate education and supervised clinical experiences. So additionally, all these counselors engage in ongoing professional development to stay abreast of emerging research and best practices in the field. And the last one is scope of practice. This is also very important. Mentors. Mentors typically focus on career related goals, professional development, and skill enhancement within a specific domain or industry. They may offer advice on topics such as career planning, job search strategies, leadership development, and workplace dynamics. Where counselors address a broader range of psychological, emotional, and relational issues that may impact an individual's overall well-being and functioning. So they provide therapeutic interventions tailored to the client's unique needs and goals, addressing issues such as mental health and disorders, life transitions, trauma, addiction, and interpersonal conflicts. So I can say, while both mentors and counselors play valuable roles in supporting individuals' growth and development, they operate within distinct contexts with different focuses, different approaches, and different qualifications. So, mentors provide guidance and support related to career advancement and skill development, drawing from their own experiences and expertise, while counselors offer therapeutic interventions to address psychological, emotional, and behavioral concerns, promoting healing, growth, and well being. So, this is the difference between mentor and counselor.
Wow, 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 wow. Thank you so much. You've really elaborated it. I've gained more knowledge on these things that you have really shared with us this morning. And I want to say thank you. Truly, truly, you are a professor.
Thank you.
And we're really blessed and privileged to be having you regularly. I think you still have one or two sections with us, even though we miss you on Saturday, but because you've been traveling, so we understand. But even coming back to give us this in-depth information is even more better for us. And I want to say thank you so much for the time, and thank you for your delivery, and thank you so much. We look forward for your next section. And if you want to start 9 o'clock, that is fine. Thank you for starting early today. We
Thank
really
you.
appreciate that. Thank you so much, Professor Patrick Mungekar. Reverend Professor, Papa Akpabio, do you have anything to say to our professor?
No, I just want to say I thank God that He has given us what it is. I only wanted to add to the whole fact that when counselors or people talk, you listen and then you gain. You know, like what you were asking in a summary of what he's saying is that counseling happens when there is a need. But mentorship is a bringing up of the person to where it ought to be.
Wow.
A counselor only takes charge when somebody has come to him, but a mentor now wants to raise a person to where it is. So I would say that counseling is actually a responsibility. While when we talk about mentorship, it is actually the investment of life in another person to become what they ought to be. So thank you, my beloved one, for giving us what the Lord has given to you. And we know everywhere the counselor and the mentorship flows the same way. Many people feel that they can be or I'm a mentor, I'm not a counselor. There are times that we counsel. A counselor provides solution and ideas for somebody, while a mentor enforces a life upon somebody to live what he wants to live. So thank you very much for being
Wow.
there, and with all your busy schedule, you are still being a part of us. We are
Yes,
actually
it
blessed.
travels a lot. It really,
Thank you.
really travels. I mean, whenever I check the social media, is with his hand luggage. I mean, it's a briefcase. I say, where is he going again?
But the Bible says, occupy till I come.
Until I come, he's really occupying at that age. And I just really appreciate you, Professor Patrick, because whenever I knock your door and say, yes, I know you are traveling, I can see you are traveling, but we need you in your home. Because yes, you can is home.
Yeah.
We need you to come. So I want to say thank you so much for joining us today. Okay, thank you. Okay.